story. Nick Dubois, let's bring you in on this, because this in a way mirrors a lot of hard work and a lot of shoe leather you put in trying to save one of your local hospitals.
Yes, Chase Farm Hospital, almost a mirror image, and Lewisham has my full support for the fight that they are doing. In 1999, Chase Farm Hospital, which had a good balance sheet, was doing well financially, was merged with Barnet Hospital and immediately lost its financial strength as it started to prop up Barnet. Since then, reconfiguration, as it's called, which is the downgrade of A&E and consultant-led maternity, has been put to the public. It doesn't have the support of the public. We've been through the marches. We've demonstrated that the public are not in favour of it. Our GPs weren't as vocal as they have been in Lewisham, but those were the days when the PCTs ruled with a rod of iron, so I almost understand. What we've ended up with is initially been argued on clinical safety, which is about people fundamentally.
Yes.
But what's driven this is the appalling PFI agreements that saddled North Mids Hospital, neighbouring North Mids, neighbouring Barnet, and they've come along and ruthlessly said, finally, we need the patients from Chase Farm to fund this PFI debt. Well, they got that wrong, so Chase Farm, best positioned strategically from big incidents from the M25. It was very significant in the Hatfield train crash. It was vital to save people's lives. We've been told that, frankly, you're going to have the downgrade because of the price for supporting these ghastly PFIs. They promised in return, these same health authority officials, that they would invest in primary care. Because, in fairness, quite a lot of people go to A&Es that actually don't need to, and the idea was to keep them out. We haven't had that investment. So we are continuing to press Secretary of State that this hospital should not be downgraded.
But Nick Dubois, you're a Conservative MP. I remember David Cameron saying the Conservatives are the party of the NHS. We've just looked at Lewisham, we've just heard your instance. How would you respond to that? You're not, are you?
Well, it's very clear that the constituents in Enfield have been let down very badly by both the last government who tried to do it in 2008 and by this government. I've never hedged on this issue. And what the Lewisham consultant there, I'm sorry, I forgot his name, said...
Dr O'Donoghue.
Dr O'Donoghue said, the people have spoken, I hope the government will listen, they pledge to respect the people's views. Well, I'm afraid the evidence so far shows that they have not listened to the government's views. But I have to say, the leadership of the NHS are constantly telling the government that this is the right thing to do. They are utterly remote from public opinion. They drove consultations not in Enfield to begin with. They used to host them in central London. They would ask people in Barnet and they would ask people in Haringey, which serves North Mids, what did they think about downgrading Chase Farm?
And they wouldn't give a damn.
Guess what? They wouldn't give a damn.
Of course they wouldn't.
So it was a complete travesty, and people lost trust in them. So when Sir Bruce Keogh came out last week and said, you politicians are frustrating development in the NHS, I simply say to him, my job, I was elected on a mandate to try and save that A&E, and he just demonstrates how out of touch they are with reality, that they think that they can pontificate about what is right for us without engaging in genuine consultation.
Nick, thanks for that, and for all the important background as regards that decision. That's coming up tomorrow morning. There will be